Good afternoon, everyone. I'm Steve Shell. I will go ahead and call to order our Treatment and Recovery Subcommittee meeting. Great to see everyone. Next, we will do our roll call to establish quorum. So I'll turn it over to Kelly Marshall.
Thank you. Assemblywoman Claire Thomas.
Here.
Chelsea Cheatham. Dr. Leslie Dixon.
Here.
Steve Shell.
Here.
Jeffrey Iverson. Dorothy Edwards.
I'm here.
Mr. Chair, we have a quorum.
Great. Thank you, Kelly. Next item on our agenda is public comment. Please bear with me as I read a brief statement. Public comment will be received via the Zoom meeting. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. Also, a friendly reminder, please do not utilize the chat for anything other than technical issues because the content is not necessarily available to the general public, which is a requirement of the open meeting law. And on that note, I'll turn it back to Kelly Marshall.
All right. So if you are dialing in from a telephone in the United States, please dial 1-253-205-0468. And when prompted for the webinar ID, the numbers are 9375298. I'll say that again, 89489375-298. And you can press *6 so that we can know that you would like to make public comment. And right now we're looking for anyone to raise their hand or take themselves off mute and introduce themselves for public comment. Mr. Chair, I don't see any hands raised.
Okay, thank you, Kelly. That will conclude public comment on our agenda. Item number 3 on our agenda is the review and approval of our minutes from our September 3rd, 2024 Treatment and Recovery Subcommittee. Hopefully all of our subcommittee members have had a chance to review the minutes, and if so, we can entertain a motion to approve.
It's Dr. Dixon. I'll move to approve.
Thank you, Dr. Dixon. Do we have a second?
I'll second, Dorothy. Oh.
Thank you, Dorothy. Do we have any discussion regarding the minutes? All those in favor of approving the minutes, please say aye.
Aye.
Any opposed? Great. Motion carries unanimously. Moving on to item number 4 on our agenda. This is to discuss upcoming presentations. And I know at this point, as we discussed in our previous meetings, we do have 2 potential presentations for our subcommittee members to consider for the 2025 agenda. I know the first one was with Rick Reich regarding harm reduction sites. And Kelly, I'm not sure if you want to add any other detail to these.
Yes, I'm happy to. Thank you.
Thank
Kelly
you.
Marshall for the record. So per the direction of this subcommittee previously, we had heard a presentation from Assemblyman Ohrenlichter on harm reduction sites. And there were several questions that the committee had. And Dr. Ohrenlichter at that point suggested that Rick Reich, who is conceptualizing place-based or bricks and mortar harm reduction sites, would be the most appropriate person to respond to those questions. And so I reached out and spoke with Rick Reich. He is willing and available to come and present back to the subcommittee on some of the conceptual questions that you raised. For example, whether community members have been polled about their reactions to place-based harm reduction sites, if there were specific locations identified, and what the costs would be for that site, as well as timing. And so if this subcommittee directs me to place Mr. Reich on an agenda for a follow-up on harm reduction sites, then I will add that to the first available yet to be calendared meeting for 2025, so we can start the process of developing recommendations for 2025. So that was the first question, is just whether, I don't believe it requires a motion. It's simply whether the subcommittee or members of the subcommittee, any member of the subcommittee would like me to move forward with that. And then with that direction, I'll proceed.
Well, Kelly, I know I'll start out by saying that I know we've had a lot of previous discussions about harm reduction, and I know it was brought up that it would be very helpful to have Mr. Wright come and present to us. So that would be my recommendation if my fellow subcommittee members agree. I'm opening the floor to any of our subcommittee members who'd like to share any comments or ask any questions.
No, I agree. I think we should have him. Assemblyman Orlichter wasn't really able to answer some of our questions, so.
Thank you, Dr. Dixon. Is anyone opposed to us including Mr. Reich on a future agenda? Okay, it sounds like, Kelly, we all are in agreement that we'd like to see him present in the near future, so thank you.
Great. So then the second opportunity was identified actually by Assemblywoman Claire Thomas. And so Assemblywoman Thomas, I don't know if you would like to provide an introduction to your thinking on why you wanted to make that connection with Ms. Whelan. Ms. Whelan and I have also connected and discussed what she and her team would be able to speak to and what they would not be able to speak to, because they are highly regulated, because they work in the arena of specialty pharmaceuticals. And so they have stringent guidelines about what they are and are not able to talk about. And she did a great job of meeting with me to tell me what she could talk about. She also has a sense of, and her team has a sense of emerging initiatives that other states are engaging in related to both overdose reversal and pharmacological options related to, for example, medication-assisted treatment. And so they may or may not be able to speak to those things, but I think we wanted to get a sense from Assemblywoman Thomas if there was anything she wanted to share, and then again wanted to ask if the subcommittee would like me to proceed with scheduling a presentation for 2025.
Well, Kelly, this is Assemblywoman Claire Thomas for the record. I think it would be great to have both these speakers come in and, speak with us and give their assessment of what they can offer. Then that way we know more about it. So I am a yes for both.
And I feel the same as you, Assemblywoman Thomas, so thank you. Do any of our other subcommittee members have any comments or any questions?
Yeah, it's Dr. Dixon for the record. I've known Pauline for many, many years because we've been interacting for years. And she's not just a pharmaceutical rep anymore. She's more is more general now into a lot of the issues. But anyway, one thing I would like to ask her is, which came up in the SURG meeting a few weeks ago when we were talking about adolescents and so and using MAT in adolescents, and I said that we have not been routinely, and I think we're even allowed to prescribe to teenagers. Although I did a brief review of that yesterday to see if I could find out anything, and the best I could find out was old, and it's still, I think it's still 16, age 16. So she might have some insight into where things are going in terms of how we can really address the problem in adolescence, because I think prevention is supposedly the name of the game, and I wish it were working, but I don't guess it's working all that well. So with teenagers. So yeah, I'm in favor of having her come.
Thank you, Dr. Dixon. Any other comments? So Kelly, it sounds like we'd also like to proceed with Ms. Whalen as well.
Thank you so much. And just to note, Kelly Marshall for the record, Chelsea Cheatham is joining the meeting. And so we have another member of our subcommittee.
Great. Okay, Kelly, any other discussion points under this agenda item? Okay, thank you, Kelly. We will move on to item number 5, which is to finalize and adopt our recommendations. This is for possible action. Those of you on our subcommittee know that we've been discussing our recommendations for several months now. I did take our 4 recommendations that we had discussed in our previous meeting to last month's full SURG meeting and share those recommendations. The full SURG did give us some thoughts on possible revisions to a few of the recommendations, and so we'll go over those in a moment, but we'll take them one by one at the moment. The first one you'll see on your screen is the first recommendation that was presented. This was submitted by Dorothy Edwards, and there was a discussion in the full SURG meeting about the locations, about the intent of the locations in this recommendation, and whether this should also include other large public gathering places. Because as it's written today, the recommendation is specific to the NSHE campuses, the Nevada State higher education campuses. So that was just a takeaway from the last SURG meeting for us to come back and discuss whether or not we want to amend the recommendation to include other large public gathering places. And if so, we would then present that at the next SURG meeting in December, on December 11th. So just opening the floor now to discussion about that. Dorothy, I don't know if you would like to start with you and hearing of your thoughts.
I didn't. We were fortunate to have a representative from NSHE, I believe it was Steve. I'd have to check the minutes, but talk about that because it was a recommendation that was presented actually by them, and I was just sort of presenting it on their behalf initially, but and so I don't, it was specific to the campuses, and as you say there, if we do want to make a recommendation that the BDR is expanded, we'll need to see how the language turns out. We've had 30 bills drop now with language, but a lot more, of course, coming. So I don't know if we want to recommend and they send it to the analysts that are working on the language, or we wait till it drops. I'm not sure how the nuances of that particular process, but yeah, thank you.
Thank you, Dorothy. Do any of our other subcommittee members have any thoughts on this?
Yeah, this is Dr. Dixon. Do we know who's going to carry this bill?
We do. I
Present
believe
bill.
Dorothy may know.
I don't, but you carry on and I'll find out here shortly. I just don't have it in front of me.
Chair Shell,
Anyway,
I
my thought
believe
is that given the way bills go, there'll be many changes made to it anyway. Maybe it would be worth us making suggestions as which direction we would want to go.
Good point, Dr. Dixon. Kelly, I see you wanted to say something.
Oh, I just wanted to note that I believe we may have had that as part of Maddie's presentation, Maddie Larson's presentation at a previous meeting. And so Laura Hale is on. I'm wondering if I could ask her to just go back to those minutes and see if she can answer that question.
So you're asking who will present that to the legislature? Is that what you're asking?
Who had said they would sponsor it? Yes.
Yes, there were. So it was Senator Titus and Assemblywoman. Let me go back and find that. Hang on just a sec. Why don't you continue and I'll see if I can find that.
I
you.
remember Senator Titus now. I don't remember the other one, but yeah, I remember Senator Titus. And, you know, back to Dr. Dixon's point, I mean, I think you're right. We could go ahead and at least add that as part of our recommendation if we all feel that other large public gathering places would benefit as well. And in even defining it further than sports facilities and libraries if we want to.
And Assemblywoman Claire Thomas, for the record, I was wondering if we had mentioned high schools, is that something that we don't want, or because I think there might be a real need.
That's an excellent point, Assemblywoman Thomas. And I'm not sure if we discussed high schools before. Do you remember, Dorothy?
It was not part of this original presentation. No, I feel like someone asked about that. But no, this was specifically around originally the campuses, the dorms, and then expanded some suggestions, you know, but again, still on campuses, not on high school. So no.
We could certainly include high schools as part of our recommendations, you know, amendment to the recommendation. If we all agree, we could certainly include that.
Well,
Dr. Dixon, do you have any thoughts around that regarding high schools?
Yeah, it's Dr. Dixon. Well, I think putting it in the high schools, or at least in the nurse's office at the high school, or whatever they have there. I don't know if they all have nurses, but anyway, that would be a great idea. I think because obviously that's where a lot of the overdoses are taking place in the high school population. It's just that the schools get kind of funny about things like this. They don't like things imposed on them, and they don't like to have to acknowledge that they need them. And there's all kinds of issues that you can run into with school boards that might not be as difficult with NSHE, but anyway, it's just my thoughts.
Dr. Dixon, you are absolutely correct. It's almost hitting a brick wall, but I think that if it's in, if the legislators will present it, and I don't see why Dr. Titus, Senator Titus, wouldn't include high schools, because, you know, she's well aware of the need. So I think the legislators can get around CCSD, or, you know, all this local school districts.
This is Chelsea Cheatham for the record. I would suggest that if we were going to try to include high schools and anything with the school districts throughout the state of Nevada, we might want to do it as a separate recommendation, because the Clark County School District, the school police, and I believe the school nurses already are carrying naloxone on the campus. So I think it may take a little bit of investigation to figure out which school districts may have already approved naloxone on campuses and may already have this idea going, or school districts might need to figure out like where to place the naloxone. But I think if we're looking at this as just a recommendation for the Nevada system of higher education, and we wanted to include additional places, maybe we could include some specific locations on campuses where we would want it. And I know that it's already listed here, the student unions, the health centers, dormitories, but maybe include like the sports facilities on campus, training rooms, libraries, and other places like that. And then maybe do a separate recommendation for naloxone related to youth populations. I think the research around that is going to be a little bit different.
And Assemblywoman Claire Thomas, for the record, you know, if I was sitting on the HHS committee, I would have a question, and that question would be, show me the data that would justify being on the higher education campuses versus the data that would show on our high schools in the state of Nevada. And I think that, based on that information, whoever presents this bill would have to have that data and answer that question, because, I'm not the only one that would think of data. Data is very important to legislators, I found.
And for the record, Dorothy Edwards and Laura may be about to say this, so I might jumping on her, but I believe Assemblywoman Brown May was also on that
Yes.
BDR.
Yes.
Okay. Thanks.
I remember her as well now. Thank you, Dorothy. And I see Laura has lowered her hand, so that must, unless Laura still got anything else to say.
No, that was
Okay.
exactly it. Thanks.
Okay, thank you, Laura. Well, I think you all raised some very good points here. So what is kind of the general consensus among our subcommittee at the moment? Do we add other large public gathering places to this particular recommendation? Do we come back and ask, offer another recommendation regarding high schools? What, any other thoughts around that? And we can certainly entertain a motion to that effect, if anyone so chooses.
This is Dorothy. I don't know about a motion. As a member, I would support adding other large public gathering places, and probably would support the school as a separate issue, only based on my very limited experience and some other pieces of legislation with working with the school districts, which are, of course, amazing, but sometimes present additional challenges, fiscal and other challenges that we might run into. But that's just mine.
And Dorothy, are you and others thinking that our additional recommendation on this would be to also support BDR 95, but include high schools? Is that kind of our thought process as well?
I personally think that I would like to support BDR 95 with the potential inclusion of other large public gathering places. If we feel strongly about schools, I think maybe a separate, I'm not sure whether to add it as a separate recommendation or to get a little more information on how we would envision that.
So Chair Shell, I
Yes.
think your inclination to seek a motion is the appropriate thing to do, given that this group has been charged with considering the discussion of the full surge in October and come back with a ranked recommendation, which we would be ranking them today. So whatever revisions would really need to be adopted, they would need to be moved, adopted, and approved, right? Approved and adopted by this subcommittee. And then we would, in our next agenda item, rank them. So one suggestion would be to amend based on the language I've heard so far, support BDR 95 to ensure Narcan be available whenever an AED machine is wherever an AED machine is located, and on all campuses under our Nevada system for higher education, including in student unions, health centers, all levels of the dormitories, and within residential advisors' domiciles, and other large gathering places such as sports facilities, training rooms, and libraries, is what I heard. And include training of the administration, and then the rest of the sentence would continue as it is. It could also be inserted all levels of the dormitories and other large gathering places such as ... and within residential advisory domiciles and include training. So I think that's the sentence where it could be added rather than adding it as a separate sentence, unless the subcommittee wanted to leave that recommendation intact and then add a sentence that says, consider implementing Narcan in other large gathering places such as. So you could separate it from support BDR 95 by adding a sentence at the end, or you could insert it in the middle.
Very
Should
good,
the
Kelly. Thank you.
subcommittee want to move forward with that?
So on that note, do we have anyone wishing to make a motion around this?
This is Dr. Dixon. I'm not making the motion yet, but I have a question. Since the whole thing starts immediately with wherever an AED machine is located, do we have any idea of how many AED machines we're talking about and where they are located? Is there some kind of a plan, or is this just people can have them if they want them? Does anyone know?
I don't. This is Dorothy Edwards for the record. Does the language imply, though, where it says wherever an AED machine is located and on all campuses? So that, does that broaden it? So it's wherever an AED machine is and also? Or you see what I'm saying?
Yeah.
And Assemblywoman Claire Thomas for the record. That was a great question. I've been in the Regional Justice Center, and on every single floor, there is an AED machine. Point. So if you look at, are you just saying all NSHE, or are you saying facilities? How are you distinguishing that language? Because if you're saying that, I think in just about any state and federal building now, we have, the airport, we have access to that. So we need clarification.
Yeah, excellent point, Assemblywoman Thomas. I don't think we caught that before. Dorothy, do you have any insight on that or may remember?
I do not. I do not.
Kelly, I'm not remembering either, but I think it's something great that we need to clarify at the moment.
Kelly Marshall for the record, just my sense of reading this recommendation, I would likely concur with Dorothy that it's wherever an AED machine is located and on all campuses. So I think it's broader. It's not exclusive. It's not limiting it to.
That was my thought as well. Does anyone else have any other comments around that?
Chair Shell, I can go back and look at those minutes from the presentation from Maddie, because I had understood it to be just NSHE that they were looking to, because she was representing NSHE, as part of that. Although the BDR that the legislators are putting forward may ultimately come up with something broader, but I can take a look back through Maddie's presentation and provide you information. I'll just get back with you on that.
Okay, that'll be helpful, Laura. Thank you. Kelly, hearing that we need some clarification on that, I'm wondering if we move on to recommendation number 2 and then come back to number 1 while we give Laura a chance to research. Okay. So in doing that, let's move on to recommendation number 2. This was submitted by Chelsea Cheatham, and there were no suggested revisions at the last SURG meeting. So that's very good. So that's another recommendation we'll be considering today in our ranking process on another agenda item. Then moving on to recommendation number 3. This was submitted by Steve Shell, and this There were some points raised in the SURG meeting regarding this recommendation. I had noted when I had made this recommendation that we wanted certified peer recovery support specialists who have felony backgrounds and are within 7 years of their last felony conviction to be considered. And it was brought up in the last meeting, I believe it was by Assemblywoman Thomas, that what is the basis of the 7 years and what are other states doing? And I wanted to share that I have looked into it a little bit, Assemblywoman Thomas, and I found in the state of Texas, they restrict it to 5 years. I did see another state, and I'm forgetting which one, that was 7 years. So I'm not really finding that there are any national standards around that, unless any of our fellow subcommittee members know more than I do on that. But I really wasn't able to find anything that truly distinguished, really gave us some concrete guidance on what we should be proposing. In terms of which would be better to include here, whether it be 3 years, 5 years, 7 years. I'm curious to see what Dr. Dixon may think.
I'm just thinking, I'm just thinking about it. Yeah, I don't know. I don't have any thoughts right now. Other than the fact that I have a hard time thinking that this is gonna go forward in the legislature. I think it's a great idea and I absolutely agree with it, but I can't imagine if this goes to the justice committees or something that they're gonna go for this, but anyway.
Well, on that note, I agree with you on that, Dr. Dixon. I think it is, a long shot to be able to push this forward. I know it's really particularly important on the hospital side in terms of who the hospitals are able to hire. And there are a lot of peer support specialists who are being limited as to where they can work, unfortunately. But I'm not sure that's going to gain enough traction within the legislative body, but it very well could. I think it's still, I would still recommend that something be, put forward for people to at least consider. But Assemblywoman Thomas, did you have any other thoughts on that since the last SURG meeting?
The only other thought I had was the person that is a recovering drug offender. How long or what types of drugs are they looking at? Are they looking at convictions of marijuana? Are they looking for? I'm not sure, and that would be one of the questions that I would be asking us if the person was, received a felony because of marijuana, then, excuse me, we're looking at, 7 years, and now it just doesn't seem like it's a fair way of assessing the problem of getting people into being able to help others and be certified to help others with 7 years. Does 7 years make a difference? Does 10 years make a difference? What is appropriate? That's the only thing that I'm concerned with.
This is Chelsea Cheatham for the record. So the Nevada Certification Board requires that the peer recovery support specialists have at least 2 years of sustained recovery prior to certification. So I think that would be a pretty good barometer for us to kind of look at. So if we were looking at that and the options were 3 to 5, I think 3 would probably be closer to matching what's required for someone to be a certified peer in Nevada.
That's great to know, Chelsea. Thank you. How would the group feel about us amending the recommendation to say 3 years? Is there anyone opposed to that?
This Dr. Dixon, I would agree with putting the 3 years, but I kind of agree also with Assemblywoman Thomas that, you probably have to know a little bit more, or maybe a little bit, make it a little more clear. Are we talking you know, a conviction for selling fentanyl versus having a bag of marijuana. Is, you know, that's a huge difference there. And I don't know how you put all, I mean, I know you can put this all in the law, but anyway, so maybe, but that's what I would kind of agree that we need to have it a little bit more widened out, you know, broadened out as to what kind of felonies we're talking about.
Yeah, we could certainly clarify that in the last sentence of the recommendation where it says convicted of drug offenses. We can clarify those offenses if we'd like.
Well, I think also for peer recovery support specialists, they could be in recovery from substance use or mental health for the Nevada Certification Board. So I'm not sure if that's going to be really easy to clarify. And it could also be something as simple as, you know, something that's legal, like alcohol too. Someone could be in recovery from alcohol. So then how would we determine like which ones are that we're gonna specifically state? So I think maybe leaving it more general would be easier, and then that way it's kind of up.
Chelsea, on that note, do you think it's general enough the way it's written at the moment?
I think it is, because it just specifically says drug offenses or other offenses. Because that would include anything else, anything that someone's convicted of. So yeah, I think it's general enough the way it's written right now.
Okay.
So
Thank you.
Chelsea, I think
Yes.
that, Kelly Marshall for the record. So just in seeking clarification on what changes people might like from this subcommittee, and also the discussion that was had at the SURG meeting. I think the discussion of the 7 years was that the group was asking, the SURG was asking for this subcommittee to provide what you propose in lieu of 7 years. So the current law is 7 years. So I heard Ms. Cheatham say it may align better with 3 years, which was suggested at the SURG meeting, that it could be 3 years or 5 years. If that were the case, I think what you would be asking is that legislation be considered to amend NRS for people who have felony backgrounds and are within 3 or 5, this group would decide that, years of their last felony conviction. So there's the clarity that it's a conviction, and then there's also clarity about that it's convicted of drug offenses or other offenses that do not involve violent acts or sexual exploitation. So I think there's enough clarity there that the legislature could then consider whether they wanted to amend it from 7 to 3 or 5, or some other number that this group suggests. But it seems to me that the clarification that was being sought was, if it's not 7, what would you propose that it is?
So on that note, Kelly, I would make a motion to amend recommendation number 3 to change 7 years to 3 years. So that's the motion on the floor at the moment. If anyone is willing to make a second to that.
This Dr. Dixon seconded.
Thank you, Dr. Dixon. Do we have any discussion regarding the motion? All those in favor, please say aye.
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 Any opposed? Okay, motion carries unanimously. Thank you. I appreciate being able to talk through that. I see Laura Hale has her hand raised.
Thank you, Chair Shell. So when Ms. Larson presented to this subcommittee, she said, I'll just quote this is a student-driven concept informed by people with lived experience. It will be operationalized for all NSHE institutions to support low barrier access to naloxone in dorms, libraries, health centers, etc., in inconspicuous locations to ensure private access. When Ms. Edwards provided an update on that recommendation, that language was that it would ensure Narcan would be wherever an AED machine is located and on all campuses under NSHE. And so when Ms. Larson presented to the legislature, she presumably would have been talking about what NSHE was prepared to put in institutions. So how the BDR will come out, I don't know, but there was a difference between what Maddie presented and what Ms. Edwards had forwarded on behalf of the board. Don't know if
Okay, thank you, Laura. Kelly, were you about to say something? Oh, okay. So going back to our previous discussion regarding recommendation number 1, does anybody on the subcommittee have any other thoughts or questions about how we may want to amend this or propose to amend it?
Assemblywoman Claire Thomas, for the record, that was great as far as giving insight to how originally it was presented. So yes, I agree that this particular bill would be addressed to NSHE.
And Assemblywoman Thomas, just to clarify, you're meaning that this bill specific to NSHE only, right?
That's what that's what I assessed through the clarification.
Okay.
Ms. Hale.
That's
So I think you need to take that comma out. Where you want to talk, we're just talking about AAD machines on campus.
yes.
Yeah.
Thank you, Dr. Dixon. So that would be part of the amendment to this, is to remove the comma if we so choose.
And this is Dorothy Edwards, and I support what the Assemblywoman and the doctor said. My reference or my change was based on, some of our discussion we had as a committee. So I didn't have not married to that, and do support that it was NSHE because I brought it on behalf of Mr. Berry, who was the student who originated the original proposal. So thank you.
Thank you, Dorothy.
No,
So
thank you, guys.
Chair Shell, Kelly Marshall for the record. So is it removing the comma after the word located?
I think you want to remove actually the comma and the word and.
Yes.
Yeah.
Okay.
Well,
So-
yeah, but what we don't know is where the AED machines are. That's the problem, how to separate that out. Maybe we don't want AED machines in there at all. I don't know. I mean,
just to clarify, AED machines were not part of what Ms. Larson had presented initially, but it might have been something that Mr. Berry had presented to Ms. Edwards. I don't know about that.
I don't think so. I think the original was not with the AED. I think that came from discussion from the committee. And whether it was the smaller or larger discussion, but I, as just a committee member, would be fine removing AED. It almost narrows it in scope, especially since we don't know where AED and the purpose of Mr. Berry's original submission was, and he spoke pretty passionately when he spoke to our policy board, was to have it in NSHE dorms and that language that we see in front of us. So
yeah, and I doubt there's AED machines all over campus like quite
okay,
like we wanted.
I don't know.
Yeah, so
So that could certainly be part of a motion if anyone so chooses to address the AED being part of the recommendation as well. So there are basically three, from what I'm hearing, there are 3 discussion points at the moment that we could consider: removing the AED language, removing the word, the comma and the word and in the first sentence of the recommendation, and then also adding the other large public gathering places, either inserting it into what we already have written, or as Kelly had suggested earlier, having a second sentence where we say, consider also including other large public gathering places. So if anyone is inclined to make a motion around any or all of those discussion points, we can certainly entertain a motion. So I will make a motion that we amend recommendation number 1 to read as follows. That may be easier, Kelly, if I do it this way. Support BDR 95 to ensure Narcan be available on all campuses under our Nevada System for Higher Education, including in student unions, health centers, all levels of the dormitories, residential advisors' domiciles, sports facilities, and libraries, and include training of the administration of Narcan, which can take place during online freshman orientations, much like we already disseminate information about Title IX during orientation week. Training can be offered throughout the year by various clubs and programs with each institution's design. So I'm sorry, I know that was very long-winded, and hopefully I made my point about where I am recommending the changes, but that's the motion on the floor at the moment. If anyone so chooses to make a second.
Assemblywoman Thomas, I second.
Thank you, Assemblywoman Thomas. Do we have any discussion regarding the motion? All those in favor, please say aye.
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 Any opposed? Great. Motion carries unanimously. Great discussion on that. So now jumping ahead to our last recommendation, number 4. This was also presented to the SURG last month. And there were a couple of topics that came up regarding this recommendation. And for everyone to remember on the subcommittee, this was originally presented us by Dr. Morgan, and then I prepared actually the recommendation based on what she had presented. But the full SURG was asking about whether or not we consider including jails in our recommendation. And then there was also a discussion about kids who are going into jail for short-term stays and whether or not the bridge program can be incorporated into the overall justice system. And then we know there's a project that Bill Till is working on specific to juvenile facilities that we may be able to glean information from as well. And then I know there was information also raised about the FAST program that is currently being piloted in Lyon County. I'm not as familiar with that program unless anyone else is. But those are the discussion points that came up in the last SURG meeting. So we can either move forward in our agenda today with recommendation 4 as it's currently written, or we can consider including jails and any other language that all of you may feel we need to include. So I'll stop there and see if anybody has any comments or questions.
This is Chelsea Cheatham. I just wanted to clarify with the bridge program, is this bridge linkage to care or bridge linkage to MOUD? Because I'm trying to figure out about including the jails and kids.
This Dr. Dixon, the bridge program that I've been involved with the committee until it kind of lost its leader. It was really referring, well, was having the emergency room itself, doctors with peer support, start the evaluation process of the person who comes in with either withdrawal or overdose, and start talking about treatment and then referral to treatment. And I don't think it's defined that any more strictly than that, but yeah, I think the intent was that they would sometimes start the patient on MOUD in the emergency room, and some are doing it now. It's actually happening. So, and the same thing with the jails and the prisons. They're doing more and more of that, starting people on MOUD. Referring to other programs, I don't think that was, I mean, that's what we should be doing no matter what, but I'm not sure that was what the bridge program was, trying to get the ER docs to prescribe buprenorphine in the ER.
That was my understanding as well, Dr. Dixon, that it was to initiate,
Yeah,
that treatment in the ER.
right. You can't really initiate methadone, but you can initiate buprenorphine.
Right, right.
And this is Kelly Marshall for the record. I recall from Dr. Kelly Morgan's presentation, she was specifically discussing induction into MAT for people in emergency rooms.
Yeah.
Yeah, thank you, Kelly.
Okay, so if, and Chelsea Cheatham for the record, if we were gonna include jails in here, it would be specifically about starting people in jail on MAT treatment. Or if we included kids that are going to jail for short terms, it'd be using peers to get them started on MAT. So my thoughts on this would be that jails could be considered, because I was just reading here that the project that Bill Teal is working on is for juvenile justice facilities, but I thought that there were some programs that were being worked on now with starting people in jail on MAT, but I don't know what the requirements are for kids to start on MAT, and just without being a treatment provider, what would that look like?
Well, it's Dr. Dixon again. So we actually have a team in CCDC now, and I think there's a similar thing up in Reno. And I don't know about the little jails, but we are doing that. Like I said before, I just don't know about kids, if we can do it. And under 16. I mean, originally when buprenorphine came out, no, the answer was definitely no. And methadone, the answer has been definitely no, but I think 18 was methadone. But they loosen this thing up so much, I'm not sure you can a doctor or a prescriber can do whatever they want. I'm not sure. I mean, I don't think the DEA has answered that question. Has addressed the question, I should say, because I could not find anything yesterday when I tried to find something.
I know regarding the hospital specifically that there's been a major push for several years now to figure out how to motivate the hospitals to be providing this service in the ERs. And I think we're missing out on a lot of opportunities when these individuals land in emergency rooms, and we have hospitals not, starting that treatment as they possibly could. So I think that's really the emphasis behind all this related to the hospitals. We could certainly consider, possibly amending this to include jails, or even if the group, wanted to, we could also consider another recommendation specific to jails. But based on what I've already heard from some of you today, it sounds like we would still need some additional information in order to do that. But are there any other thoughts or comments? We can also certainly entertain a motion as well.
Chelsea Cheatham for the record, I'm gonna make a motion to include this recommendation as written, currently focusing on the emergency departments. Just for clarity for what it was originally written for, which is the bridge program for MOUD.
Thank you, Chelsea. I see Terry Kearns with her hand raised. Dr. Kearns?
Thank you, Chair. I'm so sorry. I just wanted to highlight that the response subcommittee had previously pushed forward a recommendation about having the 3 FDA-approved MAT available in our carceral settings. And that had gone forward, and I think that was part of Bill Till's work in getting the MOUD in the jails. So we did have a previous recommendation specifically for the jails. And I know that Bill Teal, when he presented to the response subcommittee last, said that they were hopeful to try to include juvenile facilities in the future for his project that he's working on, and getting MOUD in our it's really more focused on the rural and frontier jails because it's already exists in Clark County and Washoe. So I just wanted to highlight that for the committee, and I'm sorry I just was able to jump on from our other subcommittee meeting.
Thank you for that, Dr. Kearns. We appreciate it. So going back to Chelsea's point a moment ago, we can certainly leave the recommendation number 4 as is, unless anyone has a motion, is making a motion to change it otherwise. Okay, hearing that we don't have another motion to make any change, we will keep recommendation number 4 as is, and then move on in our agenda. So now moving on to item number 6 on our agenda is to rank our recommendations. So we will be using a formula, as was done in the past in Excel, to provide a final ranking for the recommendations. The formula weighs each ranking. Weights are determined based on relative priority. So 1 equals 8 points, 2 equals 7 points, 3 equals 6 points, 4 equals 5 points, and 5 equals 4 points. Each member will need to verbally provide their ranking. As they do so, our SEI team will enter their ranking into the Excel spreadsheet. So we will all need to please double check that our rankings have been entered correctly. And then upon that time, we will then call for a vote on moving the recommendations forward as ranked. So Kelly, do you have any other details to add to that? Or?
Kelly Marshall for the record. No, I thought you did a beautiful job, Chair Shell. I would just note that the spreadsheet was updated in real time. And so the changes that you adopted related to recommendation that 1, which is listed as TRS1, so it's Treatment and Recovery Subcommittee 1's recommendation, has been updated. It removed the AED and added sports facilities and libraries as you instructed, and then no additional changes have been made to the other 3 recommendations. So you will be ranking these recommendations in order of 1, 2, 3, and 4. So it doesn't have to, you decide as a subcommittee member, which of your recommendations is your number 1, your number 2, your number 3, and your number 4. I defer to you, Chair Shell, on how much time you want to give subcommittee members to make their determination. And then in essence, we will do a roll call and ask people to either reference the language of the recommendation, so we're sure we're on the right page, or the number TRS 2, 3, 4, or 1. And then I will record the number, the ranking number that was provided. The weight will be applied automatically. And then once we have all of the subcommittee's responses, the ranking will self-generate in that far right column J, which hopefully everyone can see. So we're trying to do this as transparently as possible. And because human error is a real thing, I'm just asking every subcommittee to make sure that I am listening to you and recording your responses appropriately.
Thank you, Kelly. So on that note, I'd like to ask my fellow subcommittee members if anyone needs some time to think through this, or if not, we can certainly go through our list of members and begin having each of us verbally give our rankings. So is anyone needing some additional time? Yes, Assemblywoman Thomas.
No, well, I was getting ready to vote.
Oh, I'm sorry. I'm sorry. Jumping ahead here. Well, if no one is opposed to jumping right into the rankings, that's what I think we should do. So Kelly, let's go ahead and start. If you'd just like to call upon each of us, and then we can verbally give our rankings.
All right, I will go in the order that is listed by committee members. So Assemblywoman Claire Thomas.
Okay. Want to make sure if you can just scroll so that, yeah, so I don't have control over the scrolling.
I can make it a little smaller so that you can see it all on one page. Is that too small? It's a little tricky there.
Okay, I believe I'm ready.
Okay.
Uh,
Please go
TR,
ahead, and I'll encourage all other subcommittees to also just check my work.
TRS3, I ranked that 1.
Okay.
TRS1, I ranked that 2. And TRS2, 3, and 4.
So I would just thank you, Assemblywoman Thomas, Kelly Marshall, for the record. So I would just note that points were attributed as Chair Shell suggested. So now these recommendations are weighted differently, and you can see that after one subcommittee member's responses, the ranking order follows exactly her order because that's the only data we have. So now we'll go to Chelsea Cheatham. Dun, 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 dun.
Okay. We're actually really similar in this. So I'm gonna just start from the top. It's gonna be 3. And then 2. And then 1. And 4.
Okay. All right, Dr. Dixon.
All right, 1 will be 1. Four will be 2. 3, let's see where 3 will be 3, and 2 will be 4.
All right. Steve Shell.
Okay, mine are as recommendation number 1 is 2. Recommendation number 2 is 3. Recommendation number 3 is 1. And recommendation 4 is 4.
All right. Dorothy Edwards. Dorothy, your audio is.
I'm sorry.
There we go.
Going down the line, it will be 1, 3, 2, and 4.
All right.
Um,
Did I get that right?
yes, I'm sorry, you were scrolling and I thought, yep.
Okay. Great. So Chair Shell, Kelly Marshall, for the record, I just, for the record, want to once again ask if Jeffrey Ireson has joined the meeting and would like to provide ranking. All right. Then I think the ranking process is closed and based on the weighted scores, the ranking now is that TRS 1 would be ranked second, TRS 2 would be ranked third, TRS 3 would be ranked first, and TRS 4 would be ranked fourth.
Great. Thank you, Kelly. So that looks like that concludes our rankings.
So I believe that the subcommittee will need then to adopt these rankings or determine if they want to make any changes or have any discussion. But I do believe we should have a motion because this will go back to the full surge in December.
So if anyone wishes to make a motion to that effect.
Assemblywoman Thomas, for the record, I'll just say so moved to the motion, to the information presented with the ranking as stated.
Thank you, Assemblywoman Thomas. Do we have a second?
Dorothy Edwards, second.
Thank you, Dorothy. Do we have any other further discussion regarding this motion? All those in favor, please say aye.
Aye.
Any opposed? Motion carries unanimously. Okay, thank you all for that. So moving on to item number 7 on our agenda, this is the presentation of our approved subcommittee recommendations at the December 11th SURG meeting. And so we have the option of each person who made the recommendation can certainly present the recommendation during the SURG meeting, or if the subcommittee chooses, I can certainly do that as I did in last month's meeting, but it's certainly open to whatever all of you would like to do. So does anyone have any strong feelings one way or another?
This is Chelsea, Chair Shell. I'm okay with you presenting my recommendation.
Okay, thank you, Chelsea.
Assemblywoman Thomas, I second that.
Okay, thank you, Assemblywoman Thomas.
Ditto, I third it. Dorothy Edwards.
Thank you, Dorothy. Dr. Dixon, I'm assuming you're good with that too.
Sure.
Okay, thank you. Awesome. Okay. So as noted, then I will make the presentation of our recommendations at next month's SURG meeting, at which hopefully all of you will be in attendance as well. Okay, so moving on to item number 8 of our agenda. This is for discussion only regarding our 2025 subcommittee membership and schedule. So in January, we will reselect subcommittee members, subcommittee chairs, and a vice chair for the full SURG. Members will need to be reappointed. The Attorney General's Chief of Staff will be reaching out to members or the appointing authority to see who will be reappointed. Also, at this point, Kelly, I don't know, are we asking today those of us that would like to remain on this committee for the coming year?
I think it's whether, Kelly Marshall for the record, I think it's whether there are any subcommittee members who would like to join a different subcommittee, or if you're comfortable continuing on this subcommittee should you not be up for reappointment. And if you are up for reappointment or are going to be replaced in some manner because the positions are based on who you or what role you represent, that we wouldn't be expecting people to continue on a subcommittee. So it's really, if you know that you're not up for reappointment, or if you're not sure and you're comfortable staying on treatment and recovery, to let us know. And if you have a desire to switch to a different subcommittee, that you also let us know.
Any comments or questions from our subcommittee members? And Kelly, we can certainly reach out to you separately if anyone doesn't share today. Okay. And then just to note, so the Treatment and Recovery Subcommittee currently meets on the first Tuesday of the month, typically at 12 noon. So that would continue through 2025 unless otherwise changed.
Yeah, and Kelly Marshall, for the record, just a note for the public, not every month. And so it's on the months that the subcommittees meet, which is a clarification I neglected to make that I would like to make. So I didn't want to imply that you will be meeting every month in 2025.
Thank you for clarifying that, Kelly. We also wanted to note that the Attorney General has a BDR to broaden the membership of the full SURG, which will likely occur in 2026. We will likely onboard members upon appointment and have them join when we begin a new year in 2026. This will also require amending the SURG bylaws to include new roles in membership. And the roles to be added include members of the general public, fire and EMS, family services and foster care, director of the Department of Indigent Defense Services or her designee, and Nevada's District Attorney Association. So those are being included as additional members to the full SURG committee. Any other points of discussion to bring up under this agenda item? Okay, hearing none, we will move on to item number 9, which is public comment. Please bear with me as I make another brief statement. Public comment shall be limited to 3 minutes per person. Members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to subparagraph 2 of NRS 241010. And Kelly, I think you may have some additional details.
Yes, so just again, if you're dialing in from a telephone in the US, please dial 1-253-205-0468. And when prompted, enter the webinar ID 8948937528. And you can press *6 so the host can prompt you to unmute. And if anyone has public comment and would like to raise their hand from the public or as a member of the subcommittee, you can do so now by raising your hand or by unmuting yourself and introducing yourself. Chair Shaw, I don't see any hands raised or people who have unmuted themselves, and I have not heard any prompts for somebody trying to make public comment by phone.
Okay, thank you, Kelly. That will conclude public comment for our meeting. And moving on to item number 10 is our adjournment. Just a reminder to everyone that the full SURG meeting is on December 11th. So we will look forward to seeing everyone at that meeting. And until then, please take care and we will adjourn this meeting. Thank you all.
Thank you, Chair.
Bye.
Thank you.
Bye, thank you.
Thank you.